for what's happening in his province. We are joined now from Regina by Saskatchewan Health Minister Don McMorris. Minister, thanks very much for joining us.
Thank you, Seamus, for having me.
Well, first of all, I wanted to talk about the Minister of Health, Leona Glukak. She was on our show yesterday morning saying any delays in terms of rolling out this vaccine to Canadians is the responsibility of the provinces. The finger is pointed at them for any delays that Canadians may be suffering. What do you think of that?
Well, first of all, I mean, the delivery of the vaccine within Saskatchewan is our responsibility. The question is how much vaccine do we get to deliver? And in Saskatchewan, we've rolled out a number of scenarios of a shortage of vaccine to a large supply, a large uptake compared to a low uptake, and we've run the scenarios, and we've set a plan to put forward for our citizens that I think is working relatively smoothly.
Now, your neighbor, Alberta, they have a supply shortage in part because officials started giving it to anybody who wanted it, and not necessarily those who were, at high risk. Who's getting vaccinated in Saskatchewan this week?
We've had a very targeted strategic plan for the rollout of our vaccine. The first week we just did our healthcare professionals. Starting a week ago Monday, we rolled it out so that every healthcare professional, anybody that had an interface with a patient, received the vaccine. Starting on Monday, we rolled it out to the high-risk groups, and starting with children from 6 months to under 5 years. So, it has been a measured rollout, and as a consequence, we haven't seen the long lineups here in Saskatchewan. We want to ensure that when we roll out a vaccine for a certain segment, that we can do that whole segment, such as, for example, this week for 6 months to under 5 years of age.
So when do you think that the general public, I mean, basically anybody who wants the vaccine can get the vaccine? When do you expect that will happen?
Well, that really is reliant on the number of vaccine shipments that we receive. We certainly know that this week our shipment is down, as it is in every province across Canada. But as we receive, a greater dosage, greater amount of dosage, we can roll it out to a larger number. What we want to do is our high-risk groups first. We're starting with children and pregnant mothers. We'll be rolling it out into other high-risk areas. And once we're finished that, then definitely the general public.
Okay, Minister, thank you very much for your time. Appreciate it.
Thank you for having me.